Hi, Farah again. So now I'm getting ready to hang my my secondary IV. So what I would do is first thing is to wash my hands. I'm going to look at the doctor's order. So this is the secondary. The primary IV is still going. So we have cefazolin 50 ml to be infused over 30 minutes. And I would, of course, ask the patient to state her name and her date of birth, and then I would verify it on her name tag. I would also look at the doctor's order that the medication is to be infused now, and that's cefazolin 50 ml over 30 minutes. And according to the calculations, it should be 17 drops a minute. So I'm going to get ready to infuse. And before I do that, again, I've checked the allergies, and I'm also looking at the site where the primary IV is being infused. There's no swelling, there's no redness. Everything is being infused. Okay, so everything is fine. So now I'll get ready to hang the medication. So I've done a couple checks. So I'm gonna get the medication, and again, just like match it with the MAR that says cefazolin 50 ml to be infused over 30 minutes. And it's for Ellen Davis, date of birth 9/1963. Look at her wristband again. And so now I'm just going to get ready to give the med. So I will get the IV tubing. So because this is the secondary, it has a little tab here, and what I am going to do is by gravity, I'm going to make this one lower. This is the primary, so I'm just going to make it lower. Okay, and the one that's higher is the one that will fall. Okay, so then I'll remove the little blue cap. I want to make sure I have it clamped so it doesn't like leak all the fluid. And then I have it to spike it in a sterile condition. So I'm just going to okay, so we got it in. Okay, and then what I'm going to do is to just get the patency. So I'm going to hang this one higher. Okay. All right. I'm just going to remove the cap, still keeping it sterile. Then I just want to, what I am going to do is to get the chamber at least like halfway. Okay, so we're good. And then I want to get rid of like any air bubbles or anything. Make sure. So we are good. Okay, and I'm just gonna put the cap back in place. All right, and then I'm just gonna wash my hands. And again, I'm gonna check the order. So we have the cefazolin, the 50 ml to be infused over 30 minutes for Ellen Davis, date of birth 9/1963. She has no allergies. So I have the right patient, the right time, it's the right dose. So Now I'm going to get my gloves. So I'm going to get clean gloves. Okay. And then what I would do is to actually just label the IV with the patient's name, the time that we've started the to be infused. So we put date and time, my initials. And for the secondary IV, we want to infuse it in the port that's closest to the IV bag. So what I would do is to make sure the primary is clamped. So it won't be infused, so it's clamped. And then as for the port, I'm going to get alcohol and just clean it real well. Okay, so I got my alcohol, and I'm just gonna clean over the port site real good. Okay, so I'm gonna do that. And let's see, that is clamped. And I just wanna get some saline. I always like to just flush just to check patency. So it's a good idea. So okay, so I'm gonna unclamp. Okay, and flush, and we're good. Okay, and then what I'll do now, I get my secondary IV. Again, I didn't touch the port site, and I'm just gonna hook it, attach. So I'm gonna attach, and it is to be 17 drops a minute. Okay, and then I'm just gonna unclamp the secondary. Okay, and make sure. So now everything is flowing like it's supposed to, at the rate that it's supposed to, 17 drops a minute. Okay, and I'm looking at the site. Everything is being infused, and everything is open. Okay, so we're all set with that. I did a couple checks. I'm just gonna remove my gloves, and I'll wash my hands again. And then I'm gonna document on the MAR that, because I have it right here, that we're infusing cefazolin 50 ml for Miss Ellen Davis with date of birth 9/19/63. So I'm just going to document, and then I'll ask the patient if she needs anything. If not, I'm going to place her in a comfortable position and give her the call light and check on her again the next couple minutes to make sure her IV sites are doing good. Okay, so patient's comfortable, have her call light, medication is being infused at the right time, and that's it. Thank you.